So, have you ever opened your mail after a medical procedure only to be hit with total shock? A surprise medical bill that's basically harder to decipher than ancient hieroglyphs? It's a pretty universal frustration for patients. But for healthcare delivery entities, it represents a massive systemic risk. Because of all this widespread sticker shock, pricing and billing transparency in the healthcare industry has triggered some really intense legal and regulatory scrutiny. If you're operating a hospital or a clinic today, you literally can no longer afford to keep your pricing in a black box.
Okay, let's dive right into this explainer and learn exactly how to master the SASB sustainability accounting standards for reporting on pricing and billing transparency. We're going to look specifically at how you quantify your transparency initiatives, how you inform your patients, and how you track your most common services so that your reporting is completely airtight.
Here is our quick roadmap for today. 1. The medical billing problem. 2. The SASB healthcare framework. 3. Informing patients before treatment. 4. Making pricing publicly available. 5. Tracking the top 25. And 6. Calculating transparency volume.
All right, let's kick things off with Section 1, the medical billing problem.
The really crucial point here is that this isn't just about dodging fines, right? Yes, there's absolutely increased attention to healthcare cost containment, which naturally brings intense regulatory oversight. But the SASB standard explicitly points out that entities that achieve compliance and institute genuinely transparent pricing structures actually do a better job of protecting shareholder value. It acts as this powerful financial shield. It's a risk mitigation strategy that directly impacts both the financial health and the long-term reputation of the organization.
Moving right along to Section 2, the SASB healthcare framework.
The credibility behind these metrics is frankly absolute. Back in August 2022, the International Sustainability Standards Board, or the ISSB, actually assumed responsibility for the SASB standards. What does that mean for you? It means these reporting guidelines aren't just arbitrary suggestions someone came up with. They are part of a globally recognized framework, entirely meant to help entities disclose sustainability-related risks that directly affect cash flows and the cost of capital.
Now, within the overall pricing and billing transparency topic, our focus lands on 3 core metrics. The first two, 270A.1 and 270A.2, are categorized as discussion and analysis metrics. Basically, they ask for detailed descriptions of your policies. But the third one, 270A.3, is a strictly quantitative metric. That one requires very specific numbers and percentages. So we're going to unpack exactly how to quantify and report on each of these right now.
Which brings us to Section 3, informing patients before treatment.
To actually satisfy this first reporting requirement, you need to describe the nature, scope, and implementation of your transparency policies. Put yourself in the shoes of a patient trying to budget for an upcoming surgery. How exactly are you clearing up the pricing confusion for them? You need to describe if you're mailing direct written communication to their home, if you're posting it clearly on your public website, or maybe you're sitting down face-to-face for a consultation prior to providing those services.
A really key reporting requirement here is detailing how your process shifts depending on who is actually footing the bill. You've got to describe your distinct approach for patients paying entirely out of pocket versus those who have insurance coverage. If a patient is insured, your disclosure needs to clearly explain how you coordinate with their insurer to determine the exact split, meaning, what amount is paid out of pocket by the patient and what amount is covered by the insurer.
What's really interesting here is that the SASB standard doesn't just ask if you communicate price. It actually demands to know the exact format of that information. You are required to describe whether you're giving patients a precise total price, maybe a range of potential prices, a rough estimate, or some other metric, like the specific percentage of the total price that the patient is going to be responsible for. Precision in how you report this format is absolutely key.
Okay, Section 4, making pricing publicly available.
When you're writing your disclosure for this next metric, you must clearly discuss if public pricing information is made available for both inpatient services and outpatient services. And the standard is super specific here. Outpatient services include literally any ambulatory setting you operate. So whether that's a hospital, a clinic, or a physician's office, you need to account for all of them.
You also have to describe the exact mechanism you're using to share this public data. Do you maintain your own dedicated, user-friendly web portal? Or maybe you plug into massive government databases that consolidate pricing data for consumers. Whatever that mechanism is, just like the previous metric, you also have to disclose the scope of the information. Are the public looking at precise prices, ranges, or estimates?
Moving on to Section 5, tracking the top 25.
25, that is the magic number we are focusing on here. The standard requires you to disclose the exact number of your 25 most common inpatient and outpatient services for which you actually provide public pricing information.
But you might be wondering, how do we avoid companies just cherry-picking obscure, super cheap procedures to report on to look good? Well, SASB strictly defines what most common services actually means. It's defined as the most frequently billed services by a simple count of procedures over the past 3 years. And that must include the current reporting period. This rolling 3-year look-back is brilliant because it ensures that the services you're reporting on are genuinely the ones impacting the highest volume of your patients.
Let's hit our final section, Section 6, Calculating Transparency Volume.
Here is the exact calculation method mandated by the standard to quantify your transparency. Step 1. Identify those 25 most frequently billed services over the last 3 years. Step 2. Count how many of those specific 25 currently have public pricing information available. And finally, Step 3. Take that number and divide it by the total number of procedures performed by your entity overall.
By following that formula, you generate a very clear, quantitative percentage that's based strictly on volume. This shows your investors, analysts, and your patients what fraction of your total operational volume is actually operating under a transparent pricing model. It's just an incredibly revealing metric about an organization's true commitment to open billing.
But hey, what if you don't just stop at 25? If your healthcare entity goes above and beyond, the framework explicitly allows you to take credit for it. If you provide public pricing for more than your 25 most common services, you have the option to disclose that higher number in your reporting. It's a great way to further signal to stakeholders that you're a true leader in pricing transparency.
So as we wrap up this explainer, I really want you to take a hard look at your own reporting practices. The SASB standards give us a rigorous, highly standardized way to quantify transparency. But the ultimate goal here goes way beyond the spreadsheet. As you implement these exact policies, initiatives, and volume calculations, ask yourself, are you using this data merely to check a regulatory compliance box, or are you actively leveraging it to build genuine, lasting trust with every single patient who walks through your doors?